Hello everyone, myself Prachi Sheth, student of Manor University. So I am going to talk about the allopurinol drug used in gout. Gout is a metabolic disorder characterized by hyperuricemia. There are two types of gout. First one is acute gout. Acute gout manifests as a sudden onset of severe inflammation in a small joint due to precipitation of urate crystals in the joint space. The joint becomes red, swollen and extremely painful that requires immediate treatment. Drugs used for acute gout are NSAIDs, colchicine and corticosteroids. Chronic gout. When the pain and stiffness persist in a joint between attacks, gout has become chronic. Other cardinal features are hyperuricemia, tophi that chalk-like stones under the skin in pinna, eyelids, nose, around joints and other places, and urate stones in kidney. In majority of patients, hyperuricemia is due to undersecretion of uric acid, while in few, it is due to overproduction. Drugs used for chronic gout are in two classification. Uricosuric drugs that are probenecid and sulfine-pyrazone, and uric acid synthesis inhibitors are allopurinol and febuxostat. Allopurinol. This hypoxanthine analog was synthesized as a purine anti-metabolite for cancer chemotherapy. However, it has no anti-neoplastic activity but was a substrate as well as inhibitor of xanthine oxidase, the enzyme responsible for uric acid synthesis. Allopurinol itself is a short-acting, 2 hours of half-life, competitive inhibitor of xanthine oxidase. At high concentrations, allopurinol becomes non-competitive inhibitor. During allopurinol administration, plasma concentration of uric acid is reduced and that of hypoxanthine and xanthine is increased. Next, pharmacokinetics. About 80% of orally administered allopurinol is absorbed, metabolized largely to alloxanthine. During chronic medication, it inhibits its own metabolism and about 1/3 is excreted unchanged, the rest as alloxanthine. Interactions. Allopurinol inhibits degradation of 6-mercaptopurine and azathioprine. Probenecid given with allopurinol has complex interaction, while probenecid shortens half-life of alloxanthine, allopurinol prolongs half-life of probenecid. Allopurinol can potentiate warfarin and theophylline by inhibiting their metabolism. A higher incidence of skin rashes has been reported when ampicillin is given to patient on allopurinol. Next, adverse effects. Hypersensitivity reaction consisting of rashes, fever, malaise and muscle pain is most frequent. Stevens-Johnson syndrome is a rare but serious risk. Gastric irritation, headache, nausea and dizziness are infrequent, and liver damage is rare. Precautions and contraindications. Liver fluid intake is advocated during allopurinol therapy. It is contraindicated in hypersensitive patient during pregnancy and lactation. It should be cautiously used in the elderly, children and the patient with kidney or liver diseases. Uses of allopurinol. Allopurinol is the first choice drug in chronic gout. It can be used in both overproducers and under-excretors of uric acid, particularly more severe cases with tophi or nephropathy. With long-term allopurinol therapy, tophi gradually disappears and nephropathy is halted, even reversed. Secondary hyperuricemia due to cancer chemotherapy or radiation or thiazides or other drugs can be controlled by allopurinol. Next, dose. Start with the 100 mg, gradually increases as needed to 300 mg per day, and maximum it can be given 600 mg per day. Caution: Allopurinol should not be started during acute attack of gout. Thank you for watching.
Okay.
Oh, bye.